I record because for whatever reason this week my class didn't record. So I just want to make sure I just recorded. I will be recording. I'm going to go along with the study guide. I have a PowerPoint that I'll go through and you guys stop me if you have any questions. You can also, I'll leave it open-ended so that if you guys have any questions about the study guide or anything, we can go over that. What I want you guys to do right now though is write your first and last name and professor in the chat. I'm going to copy and paste and then we send it to each other so that we know who's attended. It's not a requirement, but I can tell you that most of the students I've had, when they do any of these review sessions, a lot of times they do better on the exam because remember, we help write we write the exams, so we know what's on there and that. So just so you guys know, first test is going to be 50 questions. Every test will be this way other than your HESI. 50 questions, 5 math. So make sure you brush up on your math skills, because that'll be 10 points out of your total. So I want to make sure that everybody's up on their math skills. It'll be like conversions and things like that. Make sure you know how to convert from adult to child. Those people that are just joining, welcome. Please put your name and professor in the chat. If you're one of my students, don't worry about it. I know who I have. But if you're not, just everybody put your name in the chat, and if you're one of mine, you don't have to put my name in there. I know who's mine. Any questions before we get started on this review? No? Okay. All right. So guys, what I'm going to do is I'm going to go through the study guide. What I did was I put it on a PowerPoint format, so it's not so many words in front of you, because I know that's really difficult. Anybody who hasn't, please add yourself. Oh, there's one more. Oh, let's just let them join. Okay, so those that just joined, make sure that you have your first and last name and professor in the chat, because I will send it to all the professors. This is being recorded, so I will make sure that the recordings get out there. What else can I say? I think that's it. All right, so I'm going to share my screen right now with you and the PowerPoint that we're going to go over. So what I did was I broke up the study guide and emphasized on there most important, but a lot of it you're going to see is going to be similar to the layout on the PowerPoint. So we're going to take a look. If my PowerPoint wants to start. Okay, there we go. All right, so important concepts we want to remember are age-related concerns, infants, children, gun violence, and safety. Oh, why did that just do that? Everybody in? Looks like I have more. Okay, so we're going to take a look at that real quickly again. Infants, what do we know about infants? Anybody contribute? Tell me what you know about infants. What's our major worry with an infant?
SIDS.
Good. What do we know about SIDS? What are some of our factors that we're going to worry about? I give it to you here, but think about those things you know about SIDS. Smoking during pregnancy, higher rate. Later, no prenatal care, young maternal age, preterm birth, and male gender actually has a higher rate there. So what I want you to know about that is that's what we look at when we're looking at infants. We look at kids, and what do we want to know about our kids? In my class, we talked about this. If in the school nurse setting, what are we going to make sure that we are doing with our playgrounds?
Isn't it like checking the slides, checking for safety and stuff?
Yep. What do you want on the ground? You want concrete on the ground under a playground?
No concrete.
No.
Okay. So I know that seems kind of common sense like, but I just like to go over it. So I just added everybody that I think is in the waiting room. So if anybody still knows people out there waiting. What else are we looking at? No, what puts a child up? Okay. Gun safety and violence. We talked about this. What do we need to do with gun violence and safety? What are we teaching? Our primary prevention in a household with guns. What?
To lock them up.
Yep.
Keep
Lock them
them
up. Yep. Lock them up. Make sure that they're in the locked position, right? We're not going to have them out loaded so that a kid could get it. Okay, so that's gonna be our primary prevention with gun violence. And then tertiary prevention, what do we know about kids with chronic illness?
Tertiary is about maintenance of the disease.
It is, but what do we know about chronic illness and the treatment?
Medication.
They have to be
Pain.
consistent, pain.
What
Avoid
is sometimes
complication.
difficult for a parent with a child that has a chronic illness? And when I say chronic, I mean, we'll go with chronic on this one.
Coping mechanism.
Yeah, you're on the right page. Keep going. Coping mechanism. What is sometimes hard for these parents to do?
Watch their kids suffer.
Sure, but these kids are right. Yes, absolutely. And what, from a nursing standpoint, can we help them with?
Follow up.
Education.
Care.
You got it, Kim. You got it. Yep.
The follow counseling, therapy for themselves.
Community resources.
Yep. You want to help them get to these appointments, because a lot of times these kids with chronic illness, not something, minor, but if a kid's really ill, they're going to have lots of appointments, lots of doctors, and mom and dad are going to get, overwhelmed by it all. So you want to help them make those appointments, keep up with them, those kind of things, right? Don't let them pass up on their appointments. Say, how can I help you get there? Those kind of things, right? You guys are on the right page. I'm just trying to get some from you. Good. All right. So then I gave you some pictures just because I like to do pictures. I think it helps us remember. So when we're looking at this, we have our calendar. We're going to help them with their appointments, with our little ones.
Got my food.
What?
Can you please repeat the part that you were saying about the playground?
Yeah, no worries. So on a playground, you just want to look for things that wouldn't be safe for a child. So like underground, you don't want concrete underneath. You'll usually have like a gravel or like a sand or something underneath, right? To absorb the fall of a kid falling. Also, if you had like a hook somewhere, a kid could get stuck on that, right? Those kind of things. You want to look at safety on the swings. Do they have railings? Those kind of things.
So in this period, so we will be the only will be concerned the most is to give recommendations and assess if they are safe. And do the interventions like, if they riding bicycle, wear the helmet, or make sure if the playground has no cement or concrete,
Yeah.
kind of those things.
Yeah,
Okay.
exactly.
Thank you.
Sure. All right, so now we look
Professor,
at our adolescents. Go ahead, Clara. It looks like
There's
Clara.
people waiting to be in.
In the waiting room again. I don't know
Yeah.
why when I'm on PowerPoint, I can't see them. Hold on. Thank you. Okay, so guys who are just joining, please put your name and professor in the chat room. I mean, in the chat, because I will send this out to all the professors so we know who attended. Okay, we just keep track of those kind of things. It is not a requirement, as you guys know, but like I was saying in the beginning, it's a good thing to come for. Alrighty, safety with adolescents. What kinds of safety we're going to look at? Our weapons, drug abuse, alcohol abuse. Big one is driving. What do we know about driving?
Seat belt.
Yep. We're gonna make sure that
Increase
they're
in
wearing seatbelts.
accidents.
Cell phone use.
Yeah. All those things when they're driving, safety. With weapons, drug abuse, sometimes kids will say, I'm gonna hurt myself. Anybody who works with kids, what is one of the first questions you're gonna ask them?
Have you
They say
thought
they're-
about how?
Yep,
You have a
Or do you have a
plan.
plan?
Yep. Very good. Do you have a plan? And so if they say, yeah, I'm gonna, jump off the bridge, or I'm gonna shoot myself or something like this, you're gonna be like, what bridge? Where do you have access to a gun? Those kind of things, right? So these are kind of our things we want to remember with teens. We have a lot that goes on with them. Violence is oftentimes a concern with them. We talked about that in my class. Does anybody remember what kind of violence we see among adolescents?
Bullying.
Bullying.
Yeah,
Sexual.
good, because yes, and a lot of times you're going to see relationship
Peer pressure.
abuse. Yeah, domestic abuse, not domestic in the home, but between a relationship, because You know,
They
they
don't know
don't have,
boundaries. They don't know the rules of it.
exactly. So be careful when you're with that. And with those teenagers, you got to be really therapeutic because they'll try to keep everything quiet. All right, we look at our primary, secondary, and tertiary. What I will tell you is on your test, I want you to know you're going to have examples. Such and such is an example of what kind of prevention will be the type of question that you guys will see. All right, so when we're doing this, I taught my class, I think all of the professors teach the same way, but primary is prevent, secondary is screen, and tertiary is going to be treat.
Yes.
Right? So remember those P, S, and T. How's this come in play when we're planning for a child with a chronic condition? We just talked about that. And then when it comes to smoking in children diagnosed with chronic conditions, what are we going to make sure that our parents are not doing around our asthmatics or around our
Smoking.
Yeah.
Smoking.
How about vaping? Is that okay?
Mm-mm.
None of that stuff is, you know, you want to
Uh,
educate. Right,
Professor, oh, sorry, I'm so sorry. There's somebody in the waiting room waiting for
I
you
just
still.
added 2 more. So have they joined? I mean, we have like 50 people on this, so I'm hoping everybody's getting in.
Thank
I
you.
don't usually have
Thank you,
this kind of
Professor.
turnout. Are we good, Jen? Great.
Good.
Okay, so thank you for letting me know. I'm trying to keep up with it, but sometimes they pop up without me seeing. All right, so that's what we know. We know with smoking what we're going to do with our parents, right? All right, we look at preventions that we see in school. Our primary, we're educating a ton. We know obesity is a big concern in the school. We're going to help mothers qualify for the WIC system. When we get a secondary, we're going to be screening our kids for obesity with BMIs, analyzing height and weight as part of our assessments or our screenings. Oftentimes in the school setting, you'll do a hearing, vision, and weight all at the same time. So we do our screenings and then we see, you know, what flags. And then our tertiary, we know we're going to work with schools to improve quality of food in school lunches. We're going to do all this. All of this kind of goes around the idea that we're really watching for obesity among our young kids and middle-aged kids at you know, middle schools. I gave this example for violence. So in our primary, we're going to be preventing the violence from occurring. So what are we going to do? We're going to do those anti-violence campaigns. We're going to do empowerment programs before anything happens. And then we're going to do screening programs. We're going to look at our risk factors like alcohol use and things like that. And then once we already have it occurring, we're going to try to prevent the worst case scenarios. We're going to try to treat the problems and get mental health treatment. You're going to see a lot on tertiary of rehab for people who have a condition, right? Because that's helpful for them, or a support group, right? Any questions on primary, secondary, and tertiary? I think there's 2 or 3 questions on it. No. All right. We're going to see some things about public health. We know our primary goal of public health is the prevention of disease and disability. Why is public health so attractive to us as nurses? What do we see in public health nursing that is maybe not always the case? What are some things where you might say, oh, I'd like to be a public health nurse because?
You can help the community
Economy.
prevent certain things. I guess,
Resources.
yeah, create resources and help
Educate the
community.
patient.
Good. All those things
You
are
can
true.
work
And
independently.
yep, you're going to see a lot of independence and autonomy in public health nursing because you're going to be out there on, you know, without, you know, a staff of 10 behind you, right? It's like in a hospital setting. So yeah, you're going to see a lot of independence and autonomy. We know that we have a population focused practice. We work to understand problems such as gender and age, family, increased illness. We look at creating health standards that are going to decrease our mortality. We want to remind ourselves leading cause of mortality has shifted right now to chronic diseases. Population of the world is increasing because of our fertility rates. People are living longer. So we are seeing a large health disparity among our more wealthy and our poorer communities. So that's going to be our biggest thing, is going to be economics, to see those health disparities among our groups of people. Okay, so I want you to remember that about economics and some of the things that we look at. The world, when you're thinking about this, I want you to remember the world is getting bigger because people live longer and because there's much more opportunity to for increased fertility rates. We know with our patient rights, oops, I'm gonna put this over here. Okay, with our patient rights, we're going to make sure that we know that if a patient is declared incompetent, then they're not going to have the right to do what they want. But when they're known as competent, they should have the right to determine their own things and manage their own finances. Where is this particularly important? What group of people are we worried about with finances?
Elderly.
Elderly.
Yep. We see the elderly, what happens with them is there's financial abuse there. So we're going to try with our elderly or our compromised patients. We're going to make sure they're able to take care of themselves, manage their diseases, prevent complications, delay deterioration and decline, and achieve highest quality of life. So that's really going to be with our geriatric population. Those are 5 major things that we look for: self-care, manage their disease, prevent complications, delay deterioration, and achieve highest quality of life. Primary focus of community-based and community-oriented nursing. These are 2 things I do want you to know the definitions for. Community-based is going to be on the care, managing chronic illnesses and involve individuals in their decision-making. And then our community-oriented is more on the health of our individuals, families, and communities. Okay, so community-oriented nurse, we're going to look at the risks when we look at our families and our individuals and our groups. Any questions on that one? Okay. We kind of went over this already. Our role as a school nurse, what do? We do a ton of stuff. We work with our community, we work with our counseling, we work social and emotional, physical, families, education, physical activity, and nutrition. So just remember, we're going to be multifaceted when we're looking at that. When we look at our Healthy People 2020 and 2030 objectives, 2020 related to parenting, we're going to help our parents develop positive parenting skills. And for our school nurses, we're going to try to increase the school day attendance for those who have chronic illness, such as an asthma or something like that. We do see a lot of kids not come to school with chronic illness because sometimes the parents are overwhelmed or sometimes they need some education. So I want you to know both of those objectives, okay?
I'm sorry, quick question. You said the role of the school nurse, you said work with the community health and what another? Okay.
Yeah, so there's a bunch of stuff that really, I just want you to know there's lots of things that go on with a school nurse. It's not just taking care of the kids. You know, you're doing a lot of
Okay.
psychological, you're going to get those kids that come in all the time. They have a stomach ache and you'll find they come in every day at 11:30 with the same stomach ache. Usually there's something behind the stomach ache. You know, you're not going to have healthy kids that are going to have this major illness that, are coming to school. So that's just something to think about. There's all different areas here, but these 2 objectives are pretty important. Your book talks about Healthy People 2030, so that's good, but we talk a little bit about both. What do we want to think about when we are a school nurse? What's going to take priority? What are some things that if you were a school nurse would be more important in the school setting than, and not just in the school setting, but I'll give you an example. A kid comes in difficulty breathing, kid comes in with a rash, kid comes in with a loose tooth. What's going to be our priority?
Difficulty breathing.
Difficulty breathing.
Yep. Remember, you're going to use your ABCs, your airway, breathing, circulation is always going to be your priorities. Okay, so remember that if you see something about priorities as a school nurse. When we look at our families, we're going to hop around a little bit, but I tried to follow our study guide. But a family crisis we know is when a family's not able to cope. You're going to hear words like, I can't do this. I can't go on, those kind of things. So we're going to have to intervene when we hear those. We know that we have 2 ways that we look at our families. We look at their environment and their genes. So genes is going to tell us about what's going on in the family and the genetic makeup, right? And then our eco maps are what's going on in the environment. How do they, where's their social units? What kind of beliefs are they around? What kind of organizations do they belong to? Those kind of things. So I want you to know the difference between those two, okay? Important when we look at our families, we know that there is no right family. There is no normal. We don't use the word normal, right? In our book, they identify it as healthy. What were some of those features that make up a healthy family?
They spend time with each other.
Mm-hmm. What else?
Communication.
Supportive.
It's going to be hard to understand the communication among a family unless you know them really well, but you can keep your eye out on communication. What else?
How they interact.
Yeah, I like that better than communication, how they interact, sure. What are the things are we going to see a healthy family doing?
Involvement in the child's care.
Yeah, involvement in the child's care. There's some real specific things that we're going to look at that
They have
support. What else?
They're going to be comfortable around each other.
Okay, are they going to spend any time together or no?
like eating
Yes.
together at the table, showing affection, things to that nature. Can they
Okay.
hug each other?
Well, I'd be really careful about affection among one another, and I'll tell you why. Because that could be a fine line. What looks like affection to one family may be uncomfortable for another. Because remember our cultural divisions that we have, and so we have to be really careful with touching and anything like that, right? So, but we do want them spending time together. We do want them at, celebrating birthdays, holidays, that kind of thing. We don't want one of them to be off in their bedroom while everybody else is together, those kind of things, right? Does that make sense to everybody? There's a whole list in your chapter, and I want you guys to be able to identify what those are. Those are the ones we just went over, but just be very comfortable with what is defined as healthy.
What chapter does that come from? Do you know?
I think it's hard for me because it's this other book, but it's the first chapter on family. So it should have been your first chapter for this week 2. I'll go through my PowerPoints at the end if you want to remind me, and I'll tell you where it is. All right, so when we're talking about family, we're going to do home health visits. Why is a home visit a good thing?
Follow-up care.
To assess the environment.
Yep, good.
Might see something or that they wouldn't bring to the office visit.
Okay. We can really see who's involved in the family, right? Who's in the household, where they may not be identifying a neighbor or a cousin or somebody that's there all the time. What is some disadvantages there? What's true about someone having, what's true if someone comes into someone else's home? What might be a barrier?
They might not feel comfortable. Communication.
Right, they may not feel safe. They may not feel
Or something
comfortable.
being seen. Yeah, something being
Language.
seen, maybe they don't want to be seen.
Living standards are different.
Yep, very good. All those are true. So remember, when we're assessing in our first visit, what's our priority?
ABC.
Safety.
Positive rapport.
Safety.
It is ABC. So if they're there and they're not breathing, we got problems. But what I want you to think a little broader on that one. What is going to be one of our priorities when we're first in the home? Assessing the
Safety.
environment for sure.
Safety.
Safety.
Not being judgmental.
Good.
Establishing trust with the family.
Yep, exactly. So you're going to look at the environment, look at safety, and you're going to be establishing that rapport with them. Right? But remember, we don't want to be too much in the beginning, because a lot of families will get turned off to that. All right, we have different phases of a home visit. Okay, we went over this in my class. I don't know if everyone did, but so you have the initiation where you clarify why you're going, you check out all the information. What? Sorry, you check out all the information. And then you go to a pre-visit where you call the family and say, this is what's gonna happen. I'm gonna come in. This is why I'm coming. Are you guys familiar? That kind of stuff, so that they feel a little safer once you come into the home. You're always gonna be professional. You're always gonna establish your rapport, implement your ADPI whenever you're there. You're gonna have a termination phase where you review the visit with the family and plan for a future, and then our post-visit where we record the visit. You know, recording is always our last priority. I had a slide in there that's out of order, so here it is. Safety in the home for the nurse. What do we need to make sure we are doing to keep ourselves safe in the home?
Make sure the patient doesn't have, like, if they have oxygen or rags in the bathroom, stairs, you know, where is his bedroom? Probably if it's in second floor, patient is not able to walk very well. If there's lights on it, if it has marks.
Okay, that's safety for the patient, absolutely, but I'm talking about safety for the nurse.
Checking to see if they have
Checking
animals
your surroundings.
put away.
Maybe letting somebody know like the address or where you're at.
Not maybe, but
Communicate.
always. Yep,
Oh,
very
all-
good, Erica.
Where the
Yep.
exits are.
Very good. And I know this doesn't happen a lot in practice, but I will tell you best practice is to take somebody with you. I know that creates sort of, everybody always gets all like upset about that, but the reason for that is if you're not alone, that's helpful. So you don't want to bring a friend, right?
Do we,
But,
should like the
usually-
nurse be like the other sex? Like if it's a patient that is male, it shouldn't be a female nurse?
It depends on what you're doing, but
But
not
sometimes,
usually.
The device the companies provide, they have like GPS, so they know where you are. Or
Mhm.
sometimes what we do is just call them and let know what patient we will be, just in case if we see something unsafe things.
Okay, that's good. And you know that you just want to make sure you're safe there. You sit between the client and the exit. You don't visit if you're unsafe. You check in at the end when you're leaving. You're going to make sure you have somebody with you if you can. Best case scenario, which I know in practice is not always possible.
You also
but-
have them like check in with you if you don't report or something, like follow up with you.
Who would follow up with you?
Like if you haven't checked in, that somebody then follow up and make sure that you're okay.
Yeah, the problem with that is that's going to be really hard to do. So that's why you want to have a schedule before you go and you leave it with them, right? And so then they know if you're not there when you're supposed to be there, right? Because otherwise you get into the cycle of, well, I'm running an hour late. Why aren't you there? That kind of thing. Does that make sense? So you want to just have a schedule ready and then hopefully you get there on time. If you're running late, sure, you'd let them know. You're not going to go at nighttime, those kind of things.
And if you feel uncomfortable, leave.
Absolutely, absolutely. All right, that takes us to our vulnerable populations, which we talked about. They are going to be our homeless, mentally ill, our substance users, our veterans, and our migrant workers. Why are they vulnerable?
They're usually
Um,
They
uninsured.
have factors of risk.
maybe mentally, something with their mental.
Yeah, they're more at risk, right? They're more at risk for
Yes.
lots of reasons. Know that one of our primary causes of vulnerability is poverty. Again, we talked about economics and poverty. These are two big ones. You know, the stress of poverty, unemployment, poor education, it's going to cause a whole bunch of problems on a health spectrum. So just think about that when we're looking at our vulnerable populations. How can we prevent with them? With our primary, we're going to educate, we're going to give them their vaccines. Secondary, we're going to do screenings. So like we'll look for screenings for TB among this group. And then our tertiary, we're going to be conducting our therapy groups or support groups with homes for the mentally ill adults. Okay. Certain things I want you guys to remember when we're working with these vulnerable population. We want to empower them. We want them to try to get as much care as they can. So we want them to set reasonable goals. We're going to work on health promotion and disease prevention, self-care strategies. So we're going to teach like our homeless how to read their own TB tests. And then you give them a card, it's stamped, they can mail it in, they're good. You want them to make the appointments and have follow-ups. So interventions such as counseling, immunizations, and safe roads are going to be ways we can help out with our vulnerable population. Any questions about that?
No.
No, we're good. All right, I want you to know a couple acts and a couple things. So the FMLA Act is our Family and Medical Leave, which provides job protection and health benefits where employees are eligible. So they may not get paid, but they are given a time period off. Anybody who's had a baby probably has used this to extend their maternity leave. American Disabilities Act, we know, provides protection against our Americans with disabilities. We have our quality and safety education for nurses, our QSEN, which is going to help us with quality improvement, evidence-based practice, our informatics, our patient care, and safety. Any questions on this? You want to know what QSEN is? You want to know these two acts as well. All right, and this is going to be our last slide, and then we can review whatever you guys want. But who are we going to rely on as public health nurses for guidance on global health? We're going to look at our World Health Organization, right? Because that's going to cover the whole, everybody. Right? All right, I think that's my last slide. Yeah, so I'm going to stop sharing if I can do that.
Professor, will you be posting that that PowerPoint?
We
For,
cannot
like,
post
for everybody?
PowerPoints. No, we cannot post PowerPoints. What I can post is the recording, and you guys can review the PowerPoints.
Oh, thank you. That's why I'm gonna ask.
Okay.
Need a PowerPoint. Okay.
Yeah.
Thanks.
Will
Any
you post that in
questions?
the announcement? It'll be your exam review.
Right, I'll send out a YouTube link. That will be my exam review, and then with that will be the PowerPoint, so you can review them. Do you guys have any questions outstanding?
For the FMLA, can you explain again about how does it impact community and family?
Sure, so what I want you to know on that is an act that gives people the right to be off of work and take care of their families or their medical needs as needed.
Yes. Okay.
And it will hold their job. It doesn't mean they're going to get paid, but it'll hold their job.
Gotcha. Thank you.
And then
What
what about the QSIN? What should we know about that?
I want you to know exactly what that does. Thank you for bringing that up, because I want you to know everything that it does. It's quality and safety education for nurses. I'm going to pull that slide up again for you guys because I want you to know exactly what it does. And so here we go again. You guys write this down if you don't have this in front of you. Helps with quality improvement. We look at evidence-based practice with our quality and safety for our nurses. We look at our informatics. We look at our computers and our IT. We focus on patient-centered care and our safety. So I want you to use your mind when you're thinking about this. Evidence-based practice drives us as nurses. So we're going to be looking at that. We're going to look at how do we improve things so that it's better for our patients. We're going to focus on our patients. We're going to focus on computers. A lot of time you're going to see with this evidence-based practice, we're going to have nurses that don't want to do it because they say, well, what is that? And I don't want to change my charting and that doesn't matter and things like that. So you might have some hesitation with peers with our evidence-based practice, but it is what guides our nursing practice.
Are you going to send the recordings out to, are they just your students' announcements, or will we all get them?
No, the professors, we all share our recordings.
All right,
So
thank you.
tonight in my class, I will post mine and one other professor's who's completed it already. Okay, so
Okay.
it'll be YouTube. You can click on it. You guys, I would recommend in the car or even like anywhere, you don't have to watch it, if you listen to some of what we go over, that's gonna really help. So I know you don't want to hear my voice 17 times, but I'm not saying just listen to me. I'm saying listen to everybody, okay? Because what we're telling you verbally is what we want you to know,
Okay.
okay?
Professor, what about the math question? Is regular ratio proportion, conversion, kilogram to milligram, or is the, or I don't know, we need to go over that other thing?
All your math.
I love her accent. I'm sorry.
I'm
sorry,
from
what was that
Cuba,
again?
my
I couldn't
Spanish
hear
is,
it.
You got to know your math. The reason we do it like that for math is because on your NCLEX, there can be about 1,000 different types of math questions. I had 4, a friend of mine had 8. Like it just totally depends on the NCLEX you get. So we don't want to have you just study this. You know what I mean? We want you to be confident in your math when you go there. And you guys have come so far. I mean, please, I want you to have encouragement for this exam. Know that there may be some questions that are going to be 1 or more options apply. You're going to, if you see that, you're going to look at your answers really closely. Okay. I don't think there's too many, but I forget off the top of my head, maybe 3 or something like that. Okay, so, but you guys are gonna be fine. You've taken a million tests. What the thing is about community, I've told my classes, I will tell everyone, a lot of times people tend not to study the content that we give you on the study guide because it's an assumption, well, I can just apply what I know. Be really careful with that, guys, because there's certain stuff that you want to know. Like, for example, on a home visit, you want to try to get somebody to go with you. You and me and everybody else in the world knows. Ideally, is that going to happen? Who knows? But that's one of those questions on a test. That's what you're looking for. The best answer.
I'm sorry. Oh,
Professor, I have a question. So if you are taking, we have to take somebody with us. What do you mean with taking somebody with us? Like, are you talking about home care nurses or are you talking about hospitals, home visits? Or
anytime you're going into a home.
Because I work for hospice home health and usually we don't take anybody.
No, that's what I said. Be careful about what you do in practice because that's not necessarily the best way. That's probably A, the cheapest way, and B, that's what they want, you know, that's what they're going to do. So they say, oh, just go by yourself. But some hospice communities will send in, you know, maybe while the nurse is there, they'll have the, I'm drawing a total blank on the word, but the
occupational therapist
or the
CNA.
minister or whatever, you know, they have there, they'll send them in at the same time to talk to the family. So it, you know, you try to coordinate care is what you're trying to do. You know, so sometimes they have volunteers, like, I don't know if anyone's familiar, but there's volunteers that'll like go into a NICU and just hold the babies who need it. And sometimes those kind of volunteers are going to be willing to, you know, pass all the, you know, checks and all that stuff, but they'll be willing to do that if, you know, if that's required. So just be careful with practicing and test questions because you don't want to say, well, that would never happen because ideally it should.
I have a question for you. Do we need to, I mean, of course, besides Nightingale, is there anybody, any historical people we need to know?
Not on this one.
Okay, cool. Thank you.
On a couple others, there will be. I don't think so. The only person, so
besides Nightingale, I mean,
well, the only person that you might want to know about is Lillian Wald.
Wald, okay.
Yeah, because she did she started public health nursing, really.
Right. Okay.
Rose, you say?
Wald.
Lillian Wald,
W-A-L-D.
W-A-L-D. That, but I don't know you're gonna. I don't know you're gonna. I don't want to say no because of course then there'll be a question on her. But from what I remember, there's not one.
Okay.
Professor, can you clarify as far as the chapters? Like,
oh, you want me to look at that chapter on family?
Like, no, because like I get the message. So you are like the professors are using an edition and we're using a different one, or what is it like?
Right. So under your announcements, everyone should have gotten this, but I'm going to go over it with you guys just so that we're all on the same page. So Our chapters that we are making sure we know for this test is going to be 2, 3, 9, 20, 21, 22, and 31. Okay, and so some of them overlap with the old book, but some of them don't. Like 31 is school nursing on both books. And make sure you print out that paper that I think Dr. Lundy, I'm just looking at the announcement.
It's in, I think the old chapters is in announcements that each week
Yeah.
what chapters we
Each
have.
week, yep. So week 1 was 2, 3, 9. So I would guess in this new edition, the dynamics of, let me pull my stuff up. I'm going to show you guys exactly what I want you to know. It's from, I lectured on it this week in my class, but I don't know who covered what. So I'd rather just show you the chart that I'm talking about. Health of families. All right, so what I want you to know about our definitions of what we would complete, I'm just pulling it up for you guys, so there's no confusion on what I want. All right, here we go. Oops, no. What I'm believing is, let me just find it by searching for the word. I can't find it now. It's a chart in the book, I will tell you, and it says, it's a box, and the box reads characteristics of healthy families is how the title reads. So I'm guessing it's that first chapter on family, so that would probably be 20. It's a box. Make sure you guys know those healthy people 2020 stuff I went over, okay? On the test, you may see a healthy people 2030, but nothing specific. Okay, if you did not, please add your name to the chat right now because I'm copying it right now and I will be posting it for your professors. Hey now, where's the chat? Oh, there we go. Okay, so what I will do is I will copy and paste on your name and professor, and then I send it out to all the professors so everybody knows who attended. Like I said, this isn't a requirement. I would suggest you guys attend another 1 or 2 reviews. And like I said, just put it on your phone. And even if you're driving in the car, you can just listen. Okay. If you have any questions, my name is Jennifer Aloni. I'm available through Fortis. Certainly feel free to reach out to me. I hope that this was helpful. I think you guys are going to do fine. I want you to study your study guide. I want you to think about the things that we've talked about in class or you've talked about in class because we all kind of talk about the same things. And your readings that you've done, and you guys will do fine.
Thank
Thank
you.
you very much.
Okay,
Where
thank
are you
you.
located at?
Your accent is like New York.
Thank you.
Oh yeah, I'm from New Jersey. I live in Colorado, but I'm from New Jersey.
Colorado.
I know. Yeah, I wasn't sure whose accent you were talking about earlier, so I didn't want to say anything.
Well,
But
no, the Spanish lady, I'm assuming she was Spanish. I said I liked her accent, but
that's what I thought.
I was guessing that you were from New York.
Close. I spent a lot of time in New York.
There you
In
go.
Central Jersey, it's kind of like half of it's New Yorkers.
Right.
You know what I mean?
Well, thank
All
you
right.
so much for your review. We appreciate it.
You're welcome. Have a good night, everybody.
Thank
Good night.
you.
Thank you.
Thank you.
Good luck, everyone.
Thanks, good night.
You, Professor.
Yes.